What if eating foods high in protein could do more than just regulate blood sugar levels? What if they could also strengthen your immune system, assist your heart, heal your kidneys, shield your nerves, and even naturally increase your sensitivity to insulin? 6 of the best protein-rich foods for those with type 1, type 2, and pre-diabetes are shown in this video. You may have previously consumed some of them, but not in the best manner. One of them is frequently viewed as unhealthy, although science has a very different perspective. Keep watching because at the end of this video, you will know exactly what to eat, how much to eat, how to cook it, and yes, you will receive a straightforward recipe that is suitable for people with diabetes. Eggs are listed first. Eggs may be one of the best protein options for diabetics, despite their modest size, simplicity, and frequent misunderstanding. About 6.3 grams of high-quality protein, or almost 13% of the daily need, can be found in one large egg. It is nearly ideal for blood sugar regulation because it only has about 70 calories and 0.4 grams of carbohydrates. Eggs don't raise blood sugar levels because they contain almost no carbohydrates. Their ability to sustain the hormones and organs most susceptible to diabetic harm, however, makes them even more intriguing. For instance, studies indicate that eating 6 to 12 eggs a week may actually enhance insulin sensitivity and fasting blood sugar, particularly when combined with a low-carb diet. Choline, a vitamin that supports brain and nerve function and is particularly abundant in eggs, is crucial for diabetics who are at risk for neuropathy. Approximately 27% of the daily choline requirement is met by one big egg. Additionally, it contains 10% of the daily requirement for vitamin B12, which is necessary for the generation of red blood cells and neurological health, and 22% of the daily requirement for selenium, which boosts immunological function. Antioxidants like lutein and zeaxanthin, which have been found to preserve eye health, particularly against diabetic retinopathy, are abundant in the yolk, which was long wrongly accused of increasing cholesterol. Newer study dispels old myths and shows that, when balanced with a healthy diet, modest egg consumption does not increase the risk of heart disease in diabetics. One of the few foods that naturally contains vitamin D is eggs, in case you were unaware. This implies that every time you eat protein, you're also promoting the health of your bones, immune system, and even insulin. Let's look at a prevalent myth. Eggs are heart-harming. In actuality, what you eat with the egg is more important than the egg itself. The actual harm occurs when eggs are combined with processed carbohydrates like white bread or sweet bacon. In fact, eggs can balance blood sugar and lower inflammation when consumed alongside veggies or healthy fats. Eggs are best cooked by boiling, poaching, or gentle scrambling in olive oil to maximize their nutritional content. These techniques avoid the toxic chemicals that form while frying at high heat and maintain the antioxidants in the yolk. One easy dish that is suitable for diabetics. Try a 2-egg vegetable scramble cooked in a teaspoon of olive oil with spinach, red bell pepper, and feta cheese. That provides you with a consistent blood sugar level, a vitamin boost, and roughly 12 to 13 grams of protein, or 24 to 26% of the daily intake. As a quick precaution, those with advanced kidney illness may need to watch their consumption of protein and phosphorus, both of which are included in eggs, particularly the yolk. If you are on a renal diet, consult your physician or dietitian. Additionally, stay away from highly processed egg products, such as powdered eggs or prepared breakfast sandwiches, which frequently contain sodium and trans fats that are bad for your heart and blood pressure. With an average price of $2.50 to $3.50 per dozen, or around 20 to 30 cents per egg, eggs continue to be among the least expensive protein sources in the United States. This protein is inexpensive, helps maintain blood sugar stability, protects your eyes, nerves, and immune system, and, when prepared properly, tastes delicious. Edamame is the second on the list. Despite their trendy appetizer appearance, those vibrant green baby soybeans are a nutritious powerhouse for diabetics. About 18.5 grams of plant-based protein, or 37% of the daily requirement, can be obtained from 1 cup of cooked edamame, which is equivalent to 5.5 ounces or 155 grams. Additionally, it has 8 grams of fiber, or roughly 29% of your daily requirements, which helps to decrease the release of glucose into the bloodstream and lessen blood sugar spikes that occur after meals. Edamame has a low glycemic index of 15 and an exceptionally low glycemic load, making it perfect for blood sugar stability. It contains only 13.8 grams of total carbohydrates, the majority of which are fiber. However, edamame is more than just blood sugar. It aids in the treatment of some of the most prevalent problems associated with diabetes. The combination of high protein and high fiber foods promotes fullness, which can aid in managing weight and insulin resistance. Additionally, it has 15% of the daily need for folate, 20% for vitamin K, and 10% for magnesium, nutrients that help with blood coagulation, insulin function, and nerve transmission. Research has demonstrated that magnesium, in particular, lowers A1C levels over time and lowers the risk of type 2 diabetes. For diabetics who are at risk for cardiovascular disease, edamame is also a good source of isoflavones, which are natural plant components that have been found to benefit heart health by decreasing LDL cholesterol. This myth has to be dispelled. Hormonal imbalance is caused by soy. In actuality, it has been demonstrated that modest soy consumption, particularly in whole forms like edamame, is harmless and even advantageous for hormone balance in both men and women. Selecting minimally processed soy, rather than highly processed snacks or isolated soy protein powders, is crucial. Light steaming is the greatest cooking technique in terms of preparation. This preserves nutrients like isoflavones and folate while maintaining the mouthfeel. Steer clear of pan frying in oil or overcooking, as these methods might damage fragile antioxidants. Just one simple recipe? Try steamed edamame with a touch of lemon, sea salt, and garlic powder. Rich in taste and strong in fiber, this is the ideal high-protein, blood sugar-friendly snack or side dish. As a wise precaution, consult your doctor before incorporating edamame into your regimen if you have a thyroid disease or a soy allergy. Additionally, avoid pre-made frozen edamame with extra sauces or flavorings as they could include excessive sodium or sugar. In terms of economics, most U.S. grocery stores sell 16-pound bags of frozen edamame for about $2.50 and $3.50, which is enough for 2 substantial servings. This makes it one of the most reasonably priced plant meals high in protein that can help balance blood sugar, promote insulin function, enhance heart and nerve health, and leave you feeling full for hours. Nuts and seeds come in third. Nuts and seeds are among the most beneficial protein sources you can incorporate into your daily routine, regardless of whether you have type 1, type 2, or pre-diabetes. In contrast to proteins derived from animals, these plant-based alternatives also contain fiber, antioxidants, magnesium, and healthy fats, all of which are essential for maintaining insulin function, lowering inflammation, and stabilizing blood sugar. About 6 to 7 grams of protein, or 12 to 14% of the daily intake, are found in a 1-ounce portion, which is roughly a small handful of mixed nuts like almonds, walnuts, and pistachios. It also contains 2 to 3 grams of fiber and almost no sugar. Additional benefits are provided by pumpkin, chia, flax, and sunflower seeds, particularly for the heart, kidneys, and nerves, organisms that are frequently the most negatively impacted by diabetes. Let's use almonds as an illustration. Magnesium and vitamin E, which are abundant in them, help reduce oxidative stress and enhance insulin sensitivity. 1 ounce provides 19% of the daily need for protein and more than 20% for magnesium, which is especially crucial for persons with type 2 diabetes and pre-diabetes. Omega-3, which is abundant in walnuts, lowers inflammation and promotes healthy brain and nerve function. Particularly crucial for people with type 1 diabetes who are vulnerable to nerve injury. Conversely, chia seeds swell in the stomach, producing a gel-like substance that slows down the absorption of sugar and digestion. Ideal for lowering post-meal increases in all forms of diabetes. This is an interesting fact. When included in a balanced diet, frequent consumption of nuts and seeds has been proven to lower A1C levels by 10 to 15% over time. Additionally, they promote appetite management, which is essential for preventing pre-diabetic insulin resistance. However, a lot of individuals continue to believe this idea. If you have diabetes, you should stay away from nuts because they might cause weight gain. False. Nuts are high in calories, yet when consumed in moderation, their good fats actually enhance cholesterol, promote metabolic health, and prevent weight gain. They actually aid in avoiding the type of blood sugar spikes that lead to overeating. Nuts and seeds are best eaten raw or dry roasted without the addition of sugar, salt, or oil. Steer clear of honey roasted and processed snack mixes, which might increase sodium or blood sugar levels. Making your own diabetic-friendly trail mix with 1 tablespoon of each of the following ingredients: almonds, walnuts, pumpkin seeds, and sunflower seeds, as well as a dash of cinnamon is a fantastic recipe suggestion. It is gratifying, crispy, and provides hours of energy stability. A brief safety measure. Although nuts and seeds are generally harmless, the phosphorus and oxalate content should be monitored by people with kidney disease or gastrointestinal sensitivity. Additionally, chew thoroughly to increase digestion, particularly when using seeds like chia or flax. The majority of raw nuts and seeds in the United States range in price from $5 to $8 a pound. Additionally, they continue to be economical over time because a serving is only 1 ounce. Nuts and seeds provide you with protein, fiber, and healthy fats in a small, potent package, regardless of whether you have type 1, type 2, or pre-diabetes. Tofu and tempeh come in 4th on the list. Although both tempeh and tofu are made from soybeans, they provide 2 quite different sensations and 2 extremely useful tools for diabetics. First, let's talk about tofu. With only 2 grams of carbohydrates and no cholesterol, a half cup of firm tofu, or 4.4 ounces, 126 grams, has about 21 grams of complete plant protein, or 42% of the daily requirement. As a result, its glycemic index is almost insignificant. However, its amino acid profile is where the true power is found. Tofu is particularly beneficial for promoting insulin synthesis, muscle regeneration, and hormone balance since it includes all 9 essential amino acids, unlike many other plant proteins. However, because tempeh is fermented soy, it has additional digestive and intestinal health benefits that diabetics frequently require. About 16 grams of protein, 32% of the daily intake, and 6 to 7 grams of fiber, which provide longer satiety and slower glucose absorption, are included in 1 3-ounce portion of tempeh, or 85 grams. The bioavailability of minerals such as iron, 15 dV, calcium, 10 dV, and magnesium, 13% dV, is also improved by fermentation. They all directly promote neuron function, cardiac rhythm, and blood sugar management. Additionally, tempeh contains natural probiotics that may strengthen the gut barrier and reduce inflammation, 2 factors that underlie type 2 diabetes, therefore improving insulin sensitivity. Tofu is often misunderstood as a tasteless filler with no actual health advantages. However, tofu actually functions as a blank canvas, absorbing flavor exquisitely when marinated or sautéed with spices and herbs. Particularly for those who have trouble digesting heavier meats or dairy, it is easy to digest, low in saturated fat, and high in heart protective isoflavones. Tofu can be baked or sautéed gently in avocado or olive oil with chili flakes, garlic, or turmeric after the water has been pressed out. This enhances flavor without adding too many calories while retaining nutrients. The easiest way to prepare tempeh is to slice it, lightly steam or pan-sear it, and then combine it with vegetables high in fiber in a wrap or stir-fry. A recipe that is safe for blood sugar? Try pan-seared tempeh with bell pepper, sautéed cabbage, and a little low-sodium tamari sauce. It contains a lot of gut-friendly chemicals, fiber, and protein. Here's a brief safety measure. Since tempeh and tofu are both made from soy, anyone who are allergic to soy should avoid them. Additionally, commercial versions that are heavily flavored or pre-marinated could have extra sodium or sugar. Therefore, always read the label. In terms of cost, tempeh is slightly more expensive at $2.50 to $3.50 for an 8 ounces box, whereas tofu is extremely reasonably priced at about $1.50 to $2.50 for 14 to 16 blocks. Nevertheless, both provide outstanding nutritional value for the money, lowering A1C, reducing inflammation, protecting the kidneys and heart, and maintaining stable energy levels. Before we continue, may I ask where you are viewing from? Enter your nation or city in the space provided below. Seeing how many individuals worldwide are attempting to take charge of their health is always encouraging. Fatty fish is number 5. Few meals are as potent or protective as fatty fish when it comes to protein sources that are effective for people with type 1, type 2, and prediabetes. High-quality, complete protein is provided by salmon, sardines, mackerel, trout, and herring, which also provide the uncommon benefit of long-chain omega-3 fatty acids. Omega-3 fatty acids are beneficial for more than only the heart. They help shield kidneys and nerves from the gradual harm that diabetes might inflict over time, actively lower inflammation, and improve insulin sensitivity. For instance, 3.5 ounces of cooked wild salmon contains roughly 200 calories, no carbs, and about 22 grams of protein, or 44% of the daily requirement, making it incredibly blood sugar friendly. One of the main benefits of fatty fish is its ability to reduce inflammation. Chronic low-grade inflammation can exacerbate insulin resistance and increase A1C in individuals with type 2 diabetes and prediabetes. However, it has been demonstrated that consuming omega-3 fatty fish on a daily basis lowers triglycerides, fasting glucose, and shields blood vessels from the harm that high blood sugar causes. Omega-3 fatty acids also assist sustain nerve tissue and reduce immunological hyperactivity in type 1 diabetes, which causes autoimmune damage to the pancreas. A further boost is provided by sardines and mackerel, which provide 30% to 40% of the daily amount of vitamin D and 10% to 15% of the daily value of calcium, which are both essential for blood pressure management, bone strength, and immunological regulation. One intriguing advantage is that fatty fish is among the only foods that may be able to reduce urine albumin levels, which are a major indicator of renal stress in diabetics. Additionally, it promotes brain health, shields the retina, and lowers the risk of depression and memory loss, two conditions that are more prevalent in people with long-term diabetes. Let's now dispel a widespread misconception. Fish that is fatty is bad for your cholesterol. In fact, the reverse is true. Triglycerides, which are frequently high in insulin resistance and metabolic syndrome, are lowered, and HDL, the good cholesterol, is raised with omega-3 fatty acids. Baking, steaming, or grilling are the finest cooking techniques because they maintain the fragile omega-3s without adding toxic substances. Steer clear of deep frying, as this might oxidize the lipids and negate their health benefits. One recipe that is suitable for diabetics. Try roasted Brussels sprouts and a little quinoa with oven-baked fish with a garlic lemon herb crust. It is well balanced, rich in fiber and protein, and maintains stable blood sugar levels for several hours. Take precautions. Mercury levels in some fatty fish, such as swordfish, tilefish, and king mackerel, can be elevated. Aim for 2 to 3 servings of low-mercury foods each week, such as salmon, sardines, trout, or light canned tuna, for your own safety. Before consuming more fish, people who are pregnant or have liver or kidney problems should speak with a doctor. Depending on the type and whether it is canned, frozen, or fresh, fatty fish can cost anywhere from $3 to $7 per serving. Anyone with type 1, type 2, or pre-diabetes can find a cost-effective substitute without compromising nutrients in canned sardines or salmon. Protein, heart protection, nerve support, and true anti-inflammatory healing are all included in fatty fish. Lean meat comes in at number 6. Although lean beef may not receive as much attention as fish or plant proteins, it can be a potent and nutrient-dense choice for individuals with type 1 and type 2 diabetes as well as those who are pre-diabetic if it is prepared and chosen properly. About 26 grams of high-quality protein, or 52% of the daily requirement, are provided by a 3.5-ounce portion of cooked lean beef, such as sirloin tip-top round or eye of round, along with 0 grams of carbohydrates and 180 to 200 calories. It doesn't directly affect blood sugar levels because it has a 0 glycemic index. However, its nutritional profile promotes many aspects of diabetic health, particularly iron balance, insulin sensitivity, and muscle maintenance. Vitamin B12, 100% of the daily value, and zinc, 60% of the daily value, are found in abundance in beef. These minerals are vital for immune system function and nerve healing, both of which can be weakened by long-term diabetes. Additionally, it contains 30% of the daily value of niacin, which promotes healthy cholesterol levels and enhances circulation, and 15% of the daily value of iron, which is essential for oxygen delivery. Lean beef's protein helps those with insulin resistance avoid blood sugar dips and curb appetite swings, especially when combined with vegetables high in fiber. It may also help people with type 1 diabetes maintain lean muscle, particularly when glucose control is difficult. We must confront this myth. For diabetics, red meat is inherently unhealthy. This is only true for processed or high-fat cuts that are associated with cardiovascular risk and inflammation, such as bacon, sausages, or marbled steaks. However, when consumed in moderation, lean, unprocessed cuts provide iron, protein, and metabolic support without raising blood sugar levels. The ideal cooking techniques are slow roasting without scorching or charring, baking, broiling, or grilling for maximum effect. Steer clear of pan frying or deep frying in butter as these methods can increase consumption of saturated fat. A recipe that is safe for blood sugar? Snack on pieces of oven-roasted top-round beef with a little mashed cauliflower and sautéed green beans. It supports satiety and A1C control and is low in carbohydrates. One crucial precaution is to restrict the amount of red meat consumed by people with kidney problems, particularly in their later stages, in order to prevent an excessive protein and phosphorus load. Additionally, stay away from processed deli meats and cured beef products, as they frequently include extra sodium, nitrates, and sugar-based glazes that can raise blood pressure and damage the heart. The cost of lean beef varies by cut and location, but it typically costs between $5 and $7 a pound, or roughly 3 cooked portions. Lean beef is a wise high-protein choice that delivers energy, nerve protection, insulin stabilization, iron, and B vitamins that are vital for overall body function when it is balanced with veggies and healthy fats. This is especially true for people who are controlling or trying to prevent diabetes. Finally, protein is more than just muscle building when it comes to managing type 1, type 2, or pre-diabetes. It's about safeguarding the most important things. The correct proteins can help maintain steady energy levels throughout the day, lower inflammation, protect your heart, kidneys, and nerves, and promote healthy blood sugar. Each of these 6 meals offers you more than simply nourishment, whether it's the gut-friendly strength of tempeh, the anti-inflammatory properties of fatty fish, or the consistent energy from eggs and edamame. You gain control from them. If this was useful to you, please remember to subscribe so that we can send you more easily comprehensible, science-based diabetic content tailored to your needs. Please leave a remark below. What is your favorite protein to consume, and how do you like to prepare it? Together, let's gain knowledge.